Is your intestine going well, or is there a little problem? Today I will talk about the 7 alert signs of bowel cancer, also called colorectal cancer, and why is it essential for you to understand more about this type of tumor. Simply because it is the 3rd most common type of cancer, and the 2nd that kills the most. About 10% of deaths from cancer are due to this tumor, according to INCA. So stay tuned! I'm going to split this video into 2 parts. The first part is about the signs and symptoms of colorectal cancer, the ones you can see or feel that something is wrong, the warning signs. In the second part, which I think is the most important, I'll discuss prevention and some measures that can lower one's risk. What habits should you follow, and what foods should you consume to avoid this disease? I will also talk about polyps, what you should do to prevent them, and why is colorectal cancer increasing in younger people under 50. It will be a complete video, so stay until the end. But first, like the video. The more people like the video, the more YouTube distributes it to people who don't have access to doctors or hospitals. Also, share the video with your friends and family. Many lives can be saved with your help. So don't feel sorry, share it there. And tell me, do you know someone who had bowel cancer? What part of the world are you from? Please write it down there. Let's go! What are the 7 warning signs you should look out for? 7th symptom, changed bowel habits. It is very important to know your bowel habits. Some people go to the bathroom right after breakfast. If you notice that you are having changes in your bowel movement, be aware. Changes in bowel movements are common with age. They are not very alarming by themselves. However, if these changes are progressing, see a doctor. About 65% of people with bowel cancer have changes in bowel movement. 6th symptom, blood in the feces. That's why you must pay attention to your stools. What type of bleeding should you watch out for? The large intestine is divided into a few parts. The ascending colon, a transverse colon, a descending colon, the sigmoid, and then comes the rectum and anus. The right side of the colon has a peculiarity. It is more prominent and the stool is liquid, because one of the functions of the colon is to absorb the water mixed in the stool. So if the tumor is on the right side, in the ascending colon, we usually won't have symptoms of obstruction. However, the tumor may bleed more, cause anemia, or cause your stools to change color and turn pitch black, which we call melena, which has a very foul smell. On the left side, the descending and sigmoid colon is smaller, and the stools arrive more formed. On that side, there may be more intense bleeding, which drips into the toilet after you have a bowel movement, or when you go to clean yourself with toilet paper. Of course, other things can cause this. We can think of hemorrhoids, anal fissure, or even eating beetroot and changing the color of your stool to red. But it's essential to make sure it's nothing serious. 5th symptom, abdominal pain. If you've never felt abdominal pain and now you've started to feel intense cramps that don't go away and keep coming and going, or even pain when evacuating that happens when the tumor affects the rectum, seek help. Could it be excess gas? That you changed your diet? Or are you overeating fiber? He can, but if you haven't done any of that and your pain doesn't go away, see a doctor because it could be one of the symptoms of bowel cancer. 4th symptom, fatigue and tiredness. It's not that fatigue and tiredness because you slept poorly. It's a longer coat, 2 weeks, a month. In bowel cancer, this tiredness may be due to hidden anemia. As I said, the tumor may be bleeding slowly, and you will become anemic. You eat well and have iron deficiency anemia. You have to investigate. One of the leading causes of anemia with no apparent cause is bowel cancer. 3rd symptom, abdominal fulling. Abdominal fulling or bloating can be a common symptom of bowel cancer. There are several reasons for this. It could be because the tumor is partially or entirely obstructing the bowel, which can lead to a buildup of gas and stool. In addition, the tumor can hinder the transit of food and liquid, which can also lead to abdominal swelling. This excess gas can cause abdominal pain, like colic or constant pain, so it's better not to neglect. Symptom 2, unexplained weight loss. Well, if you're on a diet and you've lost weight, that's normal. I'm talking about untapped weight loss. You weighed 70 kilos and now you weigh 65 or 63. With no change in what you're eating, you're not depressed, and you're not exercising more than you used to. Weight loss due to bowel cancer can have several reasons. Because the tumor can change the ability to absorb nutrients and calories as if it were a worm that is sucking everything into it. The tumor can also increase the body's energy expenditure, making you lose muscle and fat. Also, the tumor can obstruct intestinal transit, causing nausea and vomiting. 1st symptom, a feeling that your bowel has not emptied completely. It's what we call tenesmus. You go to the bathroom, and even after you're done, you feel like there's something stuck in there that hasn't come out and that you need to go back to the toilet. This feeling of not having a complete bowel movement is a common symptom of bowel cancer. This is because the tumor can partially or entirely obstruct the intestine, giving the feeling that there is feces there, which is actually the tumor. So not having symptoms is fine, but you should know the risk factors and assess whether or not you should have bowel cancer screening to see if you have polyps. What are intestinal polyps? Colon cancer develops from certain polyps that line the lining of the intestine, the inner lining of the colon. If these mucosal cells mutate, they can turn into a colonic polyp. Most polyps do not turn into cancer, but over time, some polyps can become cancerous. It usually takes about 10 years for a polyp to turn into cancer if it is not detected and removed. What are the risk factors for bowel cancer, and why is it increasing so much in young people? Like most diseases, bowel cancer has several factors. First, age. Depending on age, the risk of bowel cancer increases significantly. As we age, our defenses get weaker. So, a polyp that was parked with low immunity can become cancer. Second, inflammatory bowel diseases such as Crohn's disease or ulcerative colitis. Inflammation in the intestine increases the risk. 1 out of 5 patients with colitis has a chance of developing colorectal cancer. Third, genetic syndromes such as Lynch syndrome, which has a high predisposition for bowel cancer, or familial adenomatous polyposis, which forms multiple polyps and also increases the risk. And here I also emphasize family history of bowel cancer. Father, mother, brother, and someone close to you should be more concerned. Fourth, taller people, which also increases the risk. These are causes you cannot change. And what risk factors do you depend on? What can you modify? Cigarettes. Cigarettes don't just increase lung cancer. They increase stomach, intestine, mouth, bladder, and many other cancers. Alcohol also increases the risk. A sedentary lifestyle leads to obesity, and a diet low in fruits and vegetables has little fiber, especially ultra-processed foods, which, in addition to having little fiber, contain a lot of chemicals that you can barely read. It will increase shelf life, but on the other hand, it will reduce your health. It is rich in processed meats such as salami, ham, turkey blanket, bologna, bacon, sausage, but also excessive red meat and saturated fat. So why is bowel cancer increasing so much in younger people? When has American society reduced starting colonoscopies from age 55 to age 45 for people at intermediate risk of getting the disease? Because they are eating wrong. A lot of industrialized food is less healthy. A lot of sedentary people. Overweight and obesity increased a lot. So how can you protect yourself against bowel cancer? 7 tips, and the last one is the most important, so stay until the end. First tip, drink plenty of fluids, especially water. When you are well hydrated, your intestines work better. This prevents constipation and helps reduce the time your stool and toxins are in contact with the colon's lining. Second tip, eat plenty of fruits and vegetables with fiber and antioxidants. Fibers, like water, accelerate the speed of feces, reducing the time of contact with the mucosa. They also improve intestinal flora. Third tip, eat spices and natural anti-inflammatory foods like turmeric and cinnamon. Fourth tip, take milk and dairy products. But isn't milk inflammatory? The latest evidence says that milk is not inflammatory. There is robust research saying that milk and dairy products, such as yogurt and cheese, can protect you against bowel cancer. Of course, if you have lactose intolerance or are allergic to milk protein, you should avoid it, right? But at first, milk prevents it. Fifth tip, do physical activities, don't stand still. Physical exercises improve the intestine's functioning, regulate your insulin and estrogen hormones, reduce inflammation, maintain your healthy weight, and reduce stress. All of this helps to prevent cancer. Sixth tip, avoid alcohol and smoke. And the seventh tip, and the most important one, is to have your checkup. At the very least, occult blood in the stool allows you to pick up traces of blood mixed in the stool that we cannot see with the naked eye. But if you are over 45 years old and at intermediate risk, it would be even more interesting to have a colonoscopy. Why intermediate risk? Because of the high risk, if there's someone in the family who has Lynch syndrome, it has to be done earlier. Early diagnosis of colon cancer increases the chances of successful treatment and full recovery and healing. So don't wait. Take care of your gut health and keep your body healthy. Did you like the video? Remember to share so that more people have this knowledge. Thank you so much for watching, and feel free to like, share, and subscribe to our channel for more informative content. If you have any questions, please leave a comment below. Remember to share so that more people have this knowledge. And what will be the following video you'll watch? I'll leave 2 recommendations here on the side. Stay healthy, stay happy!